drag my feet along the floor. Then I see you, you're walking across the campus. Cool professor studying romances. How am I supposed to pretend I never want to see you again? How am I supposed to pretend I never want to see you again?
Diabetes is a metabolic disease that can affect the body in many different ways. Type 1 diabetes, also known as juvenile onset diabetes, is genetic and occurs when the pancreas does not produce insulin, which is necessary for the metabolism of glucose in the body. Type 2 diabetes, also known as adult onset diabetes, is caused by many factors such as diet, weight, exercise, and age. It occurs when not enough insulin is produced or when the body becomes immune to insulin's effect. In a healthy person, insulin glucose molecules gather together outside the cell wall. When insulin docks at the receptor site, the GLUT4 opens, allowing glucose to enter the cell where it is used for energy. In type 1 diabetes, the immune system destroys cells in the pancreas that produce insulin. There are only a few insulin molecules compared to glucose molecules. The glucose molecules accumulate outside the cell, but since insulin attaches to the receptors less, glucose cannot move into the cell as often, so it builds up in the bloodstream. People with type 2 diabetes build up resistance to the insulin they make. The body often produces enough insulin, but there is not enough receptors or the receptors are defective. The GLUT4 cannot allow glucose into the cells and glucose builds up in the bloodstream.
Come and get it now. There's a big day waiting for you. Come and get it now. Such a big day waiting for you. If you're willing just to take a chance, you're gonna shine on my friend, shine on my friend. You were there up in my room, didn't have a word to say. Suddenly you started to move, so I thought there must be a way to get a little closer to you. Just to get a little closer to you. Come and get it now. There's a big day waiting for you. Come and get it now. Such a big day waiting for you.
Diabetes often goes undiagnosed because many of its symptoms seem so harmless. Recent studies indicate that the early detection of diabetes symptoms and treatment can increase the chance of developing the complications of diabetes. Yeah, Sean?
Can I go to the bathroom?
Yeah. Gestational diabetes often have no symptoms, which is why it's important for at-risk women to be tested at the proper time during pregnancy. Sean, what?
Can I please go to the bathroom?
Again?
Yes.
Bye.
Type 1 diabetes has some short-term effects. Some are unpleasant and some are dangerous. These include thirst, frequent urination, weakness, lack of ability to concentrate, loss of concentration, and blurred vision. Loss of consciousness is possible with very high or low blood sugar levels, but is more of a danger in insulin-dependent than in non-insulin-dependent diabetes. High levels of sugar build up in the bloodstream when a person gets type 2 diabetes. Getting blood sugar levels under control helps prevent complications from the disease later on. Unfortunately, symptoms are often not that obvious. The disease may develop very slowly, and some people may think the symptoms are the result of something less serious than diabetes. Type 2 diabetes has life-changing effects that can be managed and learned in the early stage. When type 2 diabetes begins, the body is still making insulin, but the cells can't use it, which leads to greater insulin resistance. Risk factors include being overweight and inactive. Excess fat may limit the body's ability to use insulin. Some people have no symptoms. But indications that you may have type 2 diabetes include increased hunger or thirst, a greater need to urinate, fatigue, very dry skin, blurry vision, weight loss, and sometimes tingling and numbness. Often in the hands or feet. It may take longer for sores or bruises to heal, and more infections may pop up, in addition to an increased risk of gum infections.
The most common long-term effects of type 1 diabetes include vascular abnormalities and nerve damage, which can cause damage to the organs such as the heart, kidneys, and eyes.
Perfect. There are a number of long-term effects of type 2 diabetes, including eye damage or retinopathy, nerve damage or neuropathy, kidney damage or nephropathy, and heart disease. One of the major causes of mortality in diabetic patients is heart disease. Over 60% of people who have the condition will have a heart attack, and 25% a stroke. This is because diabetes causes a buildup of cholesterol on the walls of blood vessels, which leads to them becoming narrowed. Once this occurs, it can't be reversed, starting to impede the blood supply to that tissue. This can cause both heart attacks and strokes. Another problem is high blood pressure, which can also cause strokes and heart attacks.
Is that it?
Yeah.
There are many pharmaceuticals available for people with diabetes today. There's rapid and long-acting insulin, which can be administered through a syringe and fine needle, an insulin pen, an insulin pump, or oral medication. Healthy diet and regular exercise can prevent diabetes or help people with it. Insulin injections may be tedious, but a healthy lifestyle can benefit all aspects of life. Although the treatments can ease the pain of diabetes, the symptoms can never be fully eradicated.
Type 1 diabetes cannot be prevented since type 1 has to do with your genes rather than any other cause.
Type 2 diabetes can sometimes be prevented. To reduce the chances of developing diabetes type 2, the person can take some measures, such as Some other studies have shown that reducing your stress, getting the right amount of sleep, and even having sufficient vitamin D levels can all help prevent diabetes type 2. Life with diabetes. It means that I must live a much more disciplined life than most. I must be in charge and responsible for myself at all times. It means that I must accept that some foods are out of my reach. It means that I'll worry for myself, but most of all, that those around me will worry for me. It means that it's just a life I must get used to. It means that I must always be conscious of my body, so I can't be as relaxed as those without diabetes. Those with type 1 and type 2 diabetes must have an insulin routine. The routine includes injecting insulin into their bodies at specific times and around specific areas. They must calculate what they can or cannot eat and how much insulin to inject. They must constantly monitor their blood sugar levels, and they must create an exercise routine to which they must stick to. Diabetes is referred to as a family disease since the whole family is affected by the changes the person with it must endure. It can strain relationships and place pressure on them. However, it can also bring families together. Diabetics differ from those without the disease in that they must have more responsibilities over themselves. Their routines might differ in how they eat, what they eat, how much they eat, their schedules, and exercise routines might be different or more stricter than those without it. Some daily concerns a diabetic must face includes remembering to take the necessary pills, taking the correct amount of insulin, making sure the blood sugar is at a normal level, and making sure to stick to the scheduled routine. However, those with diabetes can still establish a routine just like any other. They can still enjoy many other aspects of life despite being a diabetic.
Shine on my fire. Maybe you've got something to prove. I'll clear your doubts away. Nothing can happen too soon.